Cystic fibrosis, it's today's disease of the day. Okay, so same like last time, break down the word. Cystic fibrosis. Actually, this is going to sound really vague, and that's probably because this is quite a vague disease in that it carries a lot of different aspects to it, but we'll cover that later. Cystic fibrosis. Break down the word. Cystic, which means it forms cysts, and fibrosis. Fibrosis. So fibers are formed, osis, the disease of fibers and cysts. So this seems quite generic, and a lot of diseases carry cysts and fibers. So why is this a separate disease on its own? Okay, let's talk about what normally happens in the body, and then let's talk about what happens to people with cystic fibrosis. Here's what normally happens. When your body produces mucus, it needs to go through a process of making sure the mucus is not too dry and is actually a little wet, because mucus serves a very important job, which is to catch pathogens when it's inhaled or if it moves anywhere through a lumen in the body, and then it is pushed back out either by coughing or sneezing. Okay, how is this mucus generated, and more specifically, how do we make it so that it's not very tough and sticky? So our body is designed in such a way that we can pump out chlorine into mucus. Because by pumping chlorine into the mucus, we pump in sodium ions through the mucus. And where sodium goes, water follows. This is basic osmosis. Push the chlorine out, we need something that will convince the chlorine to leave cells and enter the mucus. So we call on a transmembrane receptor. So break down the word. Transmembrane. Trans meaning to move between two things. And then membrane is the lining for around the cells. A transmembrane receptor, or anything that receives signals or allows things to pass through, in this case called CFTR, or the cystic fibrosis transmembrane receptor, which allows chlorine to enter mucus. As a result, the cascade continues. This buildup of water in the mucus can then be wafted out of different tracts, such as the respiratory tract or the pancreatic ducts, or through the vas deferens, all of which are important tracts that we need to keep in mind when we discuss pathology. They are wafted through the mucociliary escalator, a series of little, almost hair-like strands which, when they wave around using ciliary tails, they can push mucus out of the body, essentially allowing you to cough out any pathogens which might try to keep your body as a little incubating home. Okay, so mucus, make it a little moist. Use the mucociliary escalator to get it out, and stay free of pathogens. Sounds pretty simple. So what happens in cystic fibrosis? All of that breaks down. So there's a genetic mutation, which means yes, this is inherited, but we will get into that later. There's a genetic mutation in the that translates and creates the CFTR receptor. Because of this mutation, the CFTR receptor is either faulty or just isn't made in the body effectively. As a result, people with cystic fibrosis are not able to get mucus out of their body very easily. So large portions of the body get affected. It's not just a single system that is affected, because a lot of parts of the body rely on mucus to keep itself healthy. Like we've already discussed, the respiratory tract, the reproductive tracts in males especially, but also in females, and the pancreatic ducts. Now, when you don't get enough water into mucus, that mucus becomes very rough and tough. As a result, the mucociliary escalator is not able to bring out enough mucus. And what is that mucus carrying? The pathogens that it's trying to stop. So what happens as a result is you can get subsequent complications of holding on to those pathogens. Okay, so what are the numbers like when it comes to getting this disease? So it is a 1 in 25 chance that a person might have a cystic fibrosis, maybe a cystic fibrosis carrier of the recessive allele, or there's a 1 in 2,500 chance of being somebody with cystic fibrosis and affected by cystic fibrosis. As I've already said, it's spread through a recessive allele, which means that this is an autosomal recessive disease, which means both parents need to carry the trait for the kid to have it. Furthermore, we see this mostly in Caucasian and European descents, and less so in South Asian and African descent. And symptoms. This is where things get a little complicated because there's a large variety of things that can happen because, again, it's a systemic disease. So let's talk about the disease's name itself, cystic fibrosis. Where does it come from? So let's go back to the pathology and focus on the pancreas. What does your pancreas produce? It produces trypsin and it produces other pancreatic juices. Trypsin specifically is extremely powerful. In fact, it's so powerful that it can even break down other cells when it's not reacting to proteins that it should be, to the proteins that it should be, such as the ones in our diet. And this is exactly what happens in pancreatic cystic fibrosis. The duct that allows pancreatic juices to leave the exocrine pancreas gets blocked. Because of this, the chemicals which allow trypsin to leave, along with other exocrine hormones and chemicals, they get stopped in the pancreas. Because of this stop, essentially the trypsin decides to eat the rest of the pancreas because the pancreas is made of tons of protein. And as a result, the pancreas sustains a lot of damage because of this. Now, the body, eventually the inflammation dies down and the body does its best to try to heal from the inflammation and the damage caused by the trypsin. And because it's very extensive and the pancreas isn't very easy to heal as compared to, say, the liver or the skin, the pancreas starts to form cysts and fibers. Does that sound familiar? Well, this is where we get the disease's name from, cystic fibrosis. So, to summarize, cystic fibrosis comes from the chronic pancreatic inflammation that comes from the blockage of the pancreatic duct. As a result of the blockage, trypsin ends up eating away at the pancreas, which makes it harder for the pancreas to expel the trypsin, which damages the pancreas. Okay, so chronic pancreatitis, how can that present? Well, our main concern is what's called steatorrhea, and I'm hoping I pronounced that correctly, but if I'm not, please don't sue me. Thanks. Anyway, steatorrhea. Let's break down the word. Steat and aurea. Aurea, which you will see in many words like diarrhea, for example, just means to defecate or to produce feces of. And steat, in this case, means fats. So when we see fatty stools, what ends up happening is when a patient defecates and looks down the toilet, they might recognize that their poop is actually floating, which is something they might complain about and recognize that it's not normal. Okay. In children, and because this is a congenital disorder, because you are born with this disorder, we're going to see a lot of symptoms in children. You might also see a very big difficulty in thriving. And as a result, we suspect this in cystic fibrosis as well. So that was just the pancreas. What about the respiratory system? Well, everyone seems to think that the respiratory system is the main system associated with cystic fibrosis, which is very much not true, but it is definitely affected in many ways. And one way that we've already discussed is through repetitive respiratory infections. A classic presentation where a child or a teenager might complain that they are constantly getting respiratory infections. They're not sure why. In that case, we'd be worried about cystic fibrosis. So, as a result, they might start becoming feverish frequently, they might become sick frequently, their immune system might be very weak, and with all the mucus building up, they'll get shortness of breath, they might have a very productive cough, and they might develop fevers, as I've already mentioned. And finally, with the reproductive tract, in males especially, the vas deferens relies on a mucus clearing system. And when this system is not accomplished in cystic fibrosis, it can actually result in infertility in men. So as a result, this is another key sign, especially in males. It can be in females, but it is almost definitely in males to see infertility as a result of CF. Okay, so we know what to see in a patient, and we might know what a patient might complain about. So what should we do? Okay, let's assume we're the doctor in this case, and we've got a whole perusal of things we can detect. Now, typically, patients that come in with this problem are children, and they will typically be newborns, actually, or infants. In which case, we would think a lot more systemically with regards to with all these symptoms constellating together.